All right, so we're going to talk about nasal bone decompression. All right, so with nasal bone decompression, it's this little purple bone right here. And basically what we want to do is relatively decompress it away from the frontal bone. All right, so we're going to check how does it, oh my, that was a good one. All right, I'm going to leave that off. All right, how does it decompress away from frontal bone, right? But we also want to see how does it decompress on the diagonals away as well, okay? So this can be for people that have sinus pressure or have pressure just in general on the front of their head. Now I can't put this back together. Potentially it can help with just sinuses in general. But this is just a good bone to check anytime there's just general pain or pressure on the front of the cranium. So how do we do this? So I'm going to get a little key grip here, and I'm going to come right at the most proximal portion of Kay's nose. I'm going to place my other hand into frontal bone here, and I'm just kind of stabilizing with this hand, thinking lumbrical, not like getting pokey, right? So I'm just kind of getting a purchase there, and then I'm sinking onto that nasal bone, and then I will just check how does it distract away from frontal bone? How does it distract away on a diagonal down towards the right versus a diagonal down towards the left? And you can almost see the diagonal down towards the left, there is motion and it is springy. When I go down towards the right, that is a very hard infill. And you can probably feel that actually. So from a functional mobilization standpoint, I would still stabilize the frontal bone, and then I will take up that slack down into the left, or down into the right, and now I can have her nod your chin down, Kay. Good, and now look up just a little bit. That's it right there. And as she looks up, the rest of her cranium is wanting to go up, and I'm holding that nasal bone down into the right, okay? So I typically will, that's the progression I'll typically do to work on this, is really get them into a little bit more like overall neutral position. Now I have that infill that I want, and then she goes to look up, and we're actually distracting frontal bone away from nasal bone, okay? So you'd continue doing that until you improve the infill to a springy infill, or it's just not changing. Okay, so that's a nasal bone decompression mobilization.